So hello and welcome you all to Sail to MDS Dental Academy. I am Dr. Malay, the pediatric dentist and assistant professor in College of Dental Sciences. So as for today, we are here with the few discussion of the GPSC dental exam, the coming tutor exam. So I have jotted down few important common questions from last 3 to 4 years paper of the orthodontic subject. So we are going to have the around 2 to 3 part in which we are going to discuss the important subject not given in any of your MCQ book. And please aspirant, those who are giving NEET exam or INICT and any other exam, go through this video because the quality of questions given here are good. So let's start with today's video. So what is the unwanted effect of fixed function appliance like your Herbst appliance? Whenever you use Herbst appliance, there is chance of increasing IMP angle. There is an incisor mandibular plane angle. Now, by trocoding for functional appliance with large vertical opening and less sagittal forward positioning of bite is indicated for what? So aspirant, you need a large vertical opening and the sagittal positioning should be less. Here the rule of 10 is followed. So mostly such bite is indicated for the vertical grower class 2 D1 cases. Then according to lymphoid curve, the lymphoid tissue grow rapidly to reach 200% of the adult size between 10 to 15 years. After that, it will show the involution, that is a decrease in growth. And later on in the adolescent, it is replaced by the fat tissue. Now, which of the following statement is correct about the labial wire of the FR2 appliances? So, labial wire usually lies in the middle of labial surface of maxillary incisor. It's a correct statement. They run gingival at the right angle in the natural depression between the roots of lateral incisor and canine. This is also correct statement. And the labial wire form a gentle curve distally at the height of the middle of canine root. So all three options are correct. So answer is the B. Then aspirants, neural crest cells migrating from the rhombomeres express which kind of gene? That is a homeobox. That is a Hox gene. The following is not an indication of distraction osteogenesis. Remember, in case of mild asymmetry of jaw, distraction osteogenesis is not required, but it is required in case where there is a severe maxillary deficiency or Krausen syndrome or hemifacial microsomia. Now, moderate amount of incisor crowding in the mixed dentition can be relieved by what? You can relieve by disking of primary canine or extraction of primary canine. So both A and B option are correct here. Now, differential force concept is mainly used in Beck's light wire appliance. Which of the following expand system when activated produces maximum force on the palatal suture? That is your screw type of appliance. The first ossification center of the mandible in 6 years old human embryo is found in which location? It is in the future mental foramen. Remember, in mandible we have just 2 ossification centers. Now, which type of malocclusion is often considered as genetic trait? Mostly hereditary or genetics is related to class 3 malocclusion, but in the given option, the best to select is the class 2 DU2. Now, growth of the spino-occipital synchondrosis is around which year? So, mostly we can say it is around 15 years. The maxillary teeth that have a single antagonist are your third molars. Now, separation anxiety. So at which stage of your Erickson theory you can say? You can see the state of development of basic trust. So when the child is at this stage, he will have two things. There is a trust versus mistrust. And the child having a 2 to 3 years, he will have the fear and anxiety of separating from parents. Now, what is a modeling? It is an imitation of the behavior observed by others in a dental clinic. One of the important behavior technique used in children around 6 to 9 years of age. Now, which gene is responsible for patterning of the midline? A very good question. It is a sonic hedgehog gene. Now, what is the ratio of skeletal to dental expansion obtained finally after rapid palatal expansion? That is 1:1. If there is a hyperactive mentalis, what it will cause? It will cause a lingual tipping of lower anteriors. Mostly you can see in case of the class 2 D1. What is a rocker's jaw given in the Prof? It is a jaw with a no antigonial notch. Then the continuous band of muscle that constitutes buccal mechanism is anchored at which area? It is anchored at the pharyngeal tubercle of the occipital bone. Then aspirants, the self-ligating bracket was first introduced by whom? That is by the Stolzenberg. Light source that offers shortest curing time, that is your plasma arc type of curing light. So aspirant, that was all from my side. If anybody want to join the test series, lecture series, or GPSC exam, you can DM me. But aspirants, remember one thing, don't stress so much on the past papers of your any exam, not GPSC, NEET, any. Focus mainly on the concept that help you to solve many questions. So that was all from my side. See you soon with the part 2.